All right, everyone, welcome back. We are doing a deep dive today on something super interesting, and I think it's going to be really helpful.
Yeah,
And I think pretty much everyone listening is going to either be going through this or know someone going through it.
for sure.
We're talking about aging and the female reproductive system and how things change.
Yeah. And there's so many misconceptions and almost like a fear, I feel like, around this topic.
Absolutely.
So it's good to just get it all out in the open.
Yeah, totally. And that's where we're using the Merck manual for this one because
Yeah.
it's like, just straight up medical information.
Exactly. It's a great resource.
So I guess the big question to kick things off is like, what actually happens during menopause? Like, what's going on in there?
Well, it's not like a light switch,
Yeah.
It's not like, boom, everything changes overnight.
Right.
It's really a gradual process, and it can take a while.
So it's more like a dimmer switch.
Yeah, exactly. More like a dimmer switch slowly fading out.
Okay.
And technically, menopause is defined as a full year after your last period.
Oh, wow. A whole year.
Yeah, so that whole year is all these changes are starting to happen.
It's a transition period.
Exactly, a transition period.
And I know a big part of this is that estrogen starts to decrease.
Right, estrogen is like the key player here.
What's estrogen doing exactly? I feel like we hear about it, but like, what's it doing in our bodies?
So estrogen, it's think of it like a fertilizer for different tissues down there, like the labia, clitoris, the vagina, urethra.
Okay.
And when estrogen is high, those tissues are, plump and healthy and lubricated.
Okay.
But as estrogen decreases, they can get thinner and drier. It's kind of like a plant that's not getting enough water.
Oh, I see.
It just kind of shrivels up a bit.
So it's not just about period stopping, it's about like the actual tissues changing.
Exactly. It's happening on a cellular level.
Wow. Okay. And this thinning, you said it can cause like discomfort?
Yeah, I mean, if things are dry and, more delicate, it can lead to more discharge and those
It's
UTI.
urinary tract infections.
Yeah, exactly. And a lot of women don't realize that those can be connected to these hormonal changes.
Right. It's all related.
It is.
And on top of that, the Merck manual was talking about how like the uterus and the fallopian tubes and the ovaries, they all start to shrink too.
Right. All those organs kind of downsize a bit.
So that must contribute to that feeling of like things shifting around down there.
Yeah, and sometimes that shifting can lead to something called prolapse.
Okay. I've heard of that, but I don't really know what it is.
So basically, the muscles and tissues that hold your pelvic organs in place, they start to weaken with age.
So it's like the scaffolding isn't as strong.
Exactly. And then those organs can kind of drop down and press on the pelvic area.
Oh, that sounds uncomfortable.
It can cause pressure or fullness or even a bulge. And in some cases, it can make it harder to control your bladder or bowels.
So like incontinence.
Exactly.
Yeah.
And that can have a huge impact on your daily life.
Oh, absolutely. And I know the Merck manual mentioned childbirth as like a risk factor for this.
It is childbirth. Especially vaginal deliveries can increase the risk, but it's important to note that any woman can experience prolapse.
Right. It's not just about childbirth.
And aging itself plays a role too.
Makes sense. And while we're on the topic of changes, we got to talk about breasts
Oh, yeah.
because they change too, right?
They do. As estrogen levels decline, breast tissue tends to become smaller and less firm.
Okay.
It's because that connective tissue that gives them support, it weakens, and so they lose their shape a little.
So it's not just about size. It's also about like the composition of the breast changing.
Yeah, that too. The fibrous tissue starts to get replaced by fat.
Wow. It's crazy how interconnected everything is.
It really is.
And there was this one line in the Merck manual that I thought was really interesting.
Oh, yeah.
It said, some women enjoy sexual intercourse more after menopause.
I know, right? You don't hear that very often.
Not at all. Like usually it's all doom and gloom.
Right, everything's going downhill.
But this is saying it can actually get better.
It can, and I think it challenges that idea that aging and menopause automatically mean the end of pleasure.
Totally. It's like a whole new chapter.
Exactly.
But I'm curious, with the dryness and all that, doesn't that make things more difficult?
It can, but there are solutions.
Like what?
Well, there are lubricants and moisturizers and even hormone therapies that can help.
Oh, okay.
The key is to talk to your doctor and figure out what's best for you.
So it's about adapting and finding what works.
Exactly.
That seems to be the theme here with all these changes.
It is. The more we understand about these changes, the more we can embrace them and, navigate them with confidence.
That's such a good point. It's not about being afraid. It's about being informed.
Right. Knowledge is power.
Totally.
Yeah.
So for all of you listening out there, how does this change the way you think about aging and menopause?
Yeah. What are your takeaways?
And how can this knowledge empower you? Because this is really just the beginning. There's so much more to learn.
Definitely. And don't hesitate to reach out to your healthcare provider.
They're a great resource.
Absolutely.
But ultimately, remember, aging is a natural process. It happens to everyone.
It does.
And understanding what's happening in our bodies can help us go through it with more confidence and, feel better overall.
Couldn't have said it better myself.
All right, everyone. Thanks for joining us on this deep dive.
See you next time.
Bye.